Good morning, doctor. Could you please introduce yourself?
Yes, thank you for your invitation. I am the director of otolaryngology and head and neck surgery of San Giovanni Rotondo in Puglia. I'm an otolaryngology and I like to work with maxillofacial surgeons and neurosurgeons.
How long have you been using piezo surgery for?
I'm using piezo surgery from 8 years, and I'm very glad to use it in these years. And little by little, I improve my surgical techniques in piezo surgery.
And what made you change from traditional rotating tools and oscillating tools to piezo surgery?
But I think that the oscillator piezo surgery is better for because it's less invasive surgery, and it is more sharp surgery, and we use less heat effect. There is no hot heat damage of the tissues. So it is why I changed my mind in these years.
And thanks to these advantages, which procedures do you perform?
I perform a lot of endoscopic surgery, transnasal surgery and transorbital surgery endoscopically. And I like it in the rhinostomy endoscopy and endonasal. It is one of my first choice because it is less invasive on the lacrimal sac and on the periorbit. I use it in the transnasal endoscopic approach to the hypophysis, to the pituitary gland, to the posterior cranial fossa, and I use a lot for the decompression of the orbit, for Graves' pathologies, and for sinusotomy, frontal sinusotomy, and in all the endoscopic surgery, transnasal and transorbital surgery.
And piezo surgery help you to change the way do you perform the surgeries?
Yeah, it changes the mind, I think, because piezo surgery itself to be more sharp in the dissection, and because you can put away only the bone that you want to put away. It is not useful to have a big damage of the bones or big surgery of the bones. But if you are in the sharp district and you want to be really precise for putting away some little sheets of bone, it's perfect. And for minimally invasive surgery, like endoscopic surgery, it's perfect for me.
Perfect. And thinking about your patient, do you find advantages for them for the post-operative days?
The healing. Yeah, the advantages for the patient are the healing, because if we don't touch with the instrument, the soft tissue, we are more sure to not damage dura, not damage the lacrimal sac, periorbit, nerves and vessels. And for the patient, the healing is faster because there is not heat effect. There is not hot effect on the tissues, so there is no granulation, less pain, and it is more simple to go to home in less days of recovery.
And thinking about piezo surgery, we have described the advantages. Are there some disadvantages also?
Yeah, these disadvantages are relatively, I think, because one disadvantage it is not a fast procedure. If you have no time, sometimes you can say, it is so slowly, but the most important thing is to use not for all surgeries, but when you start the surgery, you can use other instruments. But when you arrive near the soft tissue, near the more important structure, soft, you can change and put the piezo surgery. Not for all the procedure, but when you are just arrived, when it is normal to not damage the structures, it's really important. So the time is relatively. Another problem is the cost, like all the instruments. But if you use it in a multidisciplinary compartment, like my department, we use one instrument for neurosurgeon, maxillofacial surgeon, otolaryngology, and ophthalmology. So one instrument that is compared and shared about all the specialties.
And coming back to the operative time, you think that the learning curve of the piezo surgery, of the device, can just be the result. I mean, it could help you to just reduce this time.
But the learning curve, it is quite fast because I started sometimes in half hour to understand, 1 hour to understand the first time of surgery. But in the time in this year, I learned really quickly, and also my residents that work with me, they learned to use it in 1 or 2 procedures. The most important thing is to change mind. You work in the water because it's always cleaning. So for endoscopic surgery, like I am an endoscopic surgeon, it's good to work in the water because the optic is always cleaned and the blood come out and all is cold surgery. But at the first approach is not so simple, but after 1 or 2 procedures you can understand how to manage it, and it is really good results.
Is there anything else that you would like to add concerning piezo surgery?
I want to, I really love this technique. Not because I have something to understand. I'm something from the company, but I love this technique because it helps me to be really less invasive for the tissues, because I like to be less invasive and more conservative of the structure that you don't want to touch. And using it is you go straight direct to the bone without destroying the tissues, and with a good healing in the surgery after a few days. Another thing is important is that it is there are a lot of tips. A lot of different tips for all the endoscopic surgery, and we can use some long and short tips. And another tool that's really important is in endoscopic air surgery. And with the one tip, I use also the piezo surgery for offering the air directly from the external canal air. So another good advantage is to use in endoscopically, transnasally, and endoscopically transhair approach. Thank you a lot.
Thanks a lot, doctor, for your time. Thank you very much.
Thank you.